right, so next up is Amanda with Eleplan.
Thank you so much, Eugene. Hi, everyone, and thanks again, David, for a great presentation. As a non-research, non-PhD gal, it was really informative for me and really appreciate the insights and perspective on what you guys are building. So thank you for that. Hi, I am Amanda Lukoff. I am the co-founder and CEO of Eleplan. We are a digital care planning platform, and I'm here today to help talk through why leveraging technology, and specifically AI, can help caregivers in their journey, whether professional caregivers or family caregivers. Next slide, please. And next. Thanks. Just wanted to kind of give a quick rundown of what we're going to go through so you know what to expect. I'm going to share a bit about my family and my story and kind of the road that brought me to Eleplan, the current landscape of caregiving as we see it on our team at Eleplan, the solution that we're offering the market, and some case study to kind of put it into perspective. And then I want to open up to questions and comments. Next, please. So this is my brother, Liam. He is 27 years old, has autism, OCD, and other mood disorders that require him to have pretty much 24/7 care and supervision. He loves SNL and Stephen King, hates hiccups, tattoos, and smokers. He has a happy run when he's excited about something, which can look a lot like elopement. And he's been my North Star for as long as I can remember. My family has always been involved in different charities locally and nationally, trying to learn more about autism and how we can improve the world for people like us. And he actually inspired me to go to law school about 10 years ago. Well, I guess I started 13 years ago for special education law. I spent all of law school focused on special education law after my parents had hired a special education attorney to advocate for Liam to go to a special needs school in New Jersey where we live. And after law school, I took a detour to corporate law before immersing myself in the startup ecosystem. During COVID, I had the opportunity to work with the Autism Impact Fund and a lot of other autism-specific innovation hubs in the country that were trying to solve problems for families like ours, and really kind of had this nagging feeling that my family's pain point of caregiving wasn't being solved in the way that I wanted to. I'm 11 years older than Liam, which has given me a pretty unique view into his autism and other challenges. I've had a front row seat to his diagnosis, my parents' advocacy, and the roller coaster that has been life with Liam. There are lots of ups, but there's also a lot of downs, from school challenges and residential considerations to finding the right vocational program for him. It's been a lot. So throughout the presentation today, I'm going to share some kind of personal stories about Liam to paint our picture and what led me to creating Eleplan with my partner, Zach, who's on the call today. And that will take us to our next slide, Eugene. Thank you. So just like this slide, caregiving is overwhelming. Days are filled putting out the fires related to new diagnoses and treatments, changes in residents, varying levels of independence, navigating benefits and insurance, educational planning, behavioral challenges, long-term care. The list goes on. Today, caregivers are relying on antiquated technology, pen and paper, and disjointed sharing of key information. Care imperatives are overlooked and out of date, or sometimes even correct, and incorrect information can be shared, leading to dangerous care outcomes. Beyond all of that, mountains of paperwork and disconnected records exacerbate mounting stress and overwhelm. I've seen it in my own family and friends in our own network. Next slide, please. So take all of that and add to it. These are the questions that are going through our minds. Liam is the first thing that my mom thinks about when she wakes up and the last thing she thinks about when she goes to sleep. What keeps us up at night? Who will take care of her of Liam if something happens to my parents? In our family, that's me, but what if there's not a sibling that can step in and take care of him? How will we know what to do? Are we ready for an emergency? Where are all of the documents? Is Liam safe at home? Do we have enough money? Do the doctors know what they need to do? Where is he going to live? How do I balance this with my job? What if I get sick? Am I doing enough? Next slide, please. Next slide. Sorry, Eugene. Thank you. This is kind of layering on top of that, right? So everything that's going on in your brain, and then you're getting texts and emails and phone calls all day, every day. In my mom's situation, Liam lives with a full-time caregiver, and he's at a part of a vocational program through a local university. But she's still, even though she's not his full-time live-in caregiver anymore, she's getting text all day, every day, asking about new routines, whether it's from a new job coach or a therapist. And this is kind of the burdens that caregivers are facing, whether we're full-time caregivers, pinch hitter caregivers, or future caregivers. And we really want to try to encapsulate the stress and solve it with Eleplan. So I just kind of wanted to give this as a sense of, imagine these texts coming into you over and over again, every day, all day. Next slide, please. So what can we do? And here's where Eleplan comes in. Prioritize. Decide where you need to start and start there. Maybe it's as simple as an emergency contact sheet or something like securing guardianship, whatever it is that is most important to you and your family on that day. Decide what needs to be addressed first to make you feel more in control and your loved one more safe and cared for. Automate. Create systems around your priorities that allow you to automate whenever possible, whether it be medication reminders, communications with doctors, updates to teachers. Again, automate, but do it on your terms and on your time. Collaborate, bring others in to work through issues together. Maybe a job coach can help you sort out what you need for your child's first day of work. Maybe you need to sit with the long-term care facility supervisor to figure out next steps for your aging father. Alongside of all this, we're organizing, we're simplifying life by getting everything into one place on your platform and organizing it into a system that works for you and your priorities. So you have what you need when you need it and you know where to find it. I'll share a story in a little bit about my family with kind of the documents all over the place and the stress that causes. Beyond all of this, security is paramount. So how are you keeping the information, the documents secure? Not only is it important to know where they are, but knowing that where they're held is secure so that you have peace of mind on that front as well. And sharing with others in a way that allows you to do so efficiently and again, securely, so that the people that are taking care of your loved one alongside of you, professional or family, are able to do so with your tailored suggestions and notes and information in mind. And last but not least, Eleplan can't do this for you, but just a reminder to breathe because it's a lot. And caregiving is overwhelming, and we acknowledge that from day one at Eleplan. So next slide, please, Eugene.
I'm gonna stop you here for just one
Please.
second. So I'm thinking if someone is going to come to you, they are going to be severely disjointed. They're not going to have the documents. They're not going to have a support system in place. Do you walk them through that, or does the app walk them through that?
Yes.
Because how do I go back and get documents from other doctors, and how do I consolidate this? How do I set up a support network within my family? So, because you have, there's obviously you and your parents, there may be caregivers. So how do you share those responsibilities? Is this all part of the app? Because I may be getting ahead.
No, it's great. It's great. I love you jumping in. So the answer to all of the above is yes, the app does it in large part, but everyone has documents and everyone has people, even if that people is just a person and it's you, right? So there's always somewhere to start. In my former work as a special education lawyer, I would have clients come to our office with literal brown paper bags overflowing with documents. So they have them. It's just a matter of organizing them. Yes, we can go to our doctors and our EHRs and our my charts and get those documents, but in large part, we have somewhere to start. And the way the flow of the app works is we meet you where your needs are, which means we meet you where your feet are today. So for my brother, when he was 17, it was guardianship. Today at 27, it's residential and vocational. When he was 4, it was early intervention and getting him into an appropriate school. So wherever our users are, and again, I'm using my brother's example of autism because that's what's personal to me, but this applies to all caregivers in all situations, whether chronic illness, disability, or aging. But you start where you want, and the app guides you through those focus areas and asks you to add contacts and people that are related to that specific focus. So rather than, there is kind of a brain dump, but it's in the confines of the focuses that you are prioritizing first, if that makes sense.
No, it
And
does.
then throughout the app, there's tours that Zach has built in that kind of guide the user on, did you know that this feature can offer this solution, or don't forget to add your contact. Now that you've built out your plan, here's how you can share and customize it with the people in your network.
Yeah, because you're talking about people are overwhelmed, and and to take on something like this could be perceived as being overwhelming. To
Yes,
add this to
yes.
your task list.
Yep. It's actually, I've had it posted above my desk at home since we started the business last summer. And it says, how do we not overwhelm users? And so it's a double-edged sword, because you're right, Eugene, there is not, care plan and Eleplan is not on your to-do list today. But I know from my family's experience, and I know from every caregiver I have ever encountered, and I bet any caregiver on this call will agree, the overwhelm is the information in your brain and the fear that if something happens to you tomorrow, no one has access to that information. So we can agree that we have to take the step of getting it out of our brains and into a platform that's actually usable and accessible by others. The overwhelm of doing that, we appreciate, which is kind of why we've broken it out into focus areas that have, for example, timestamps. So we can say, this will only take you 3 minutes, just like Dua Lipa. Dua Lipa, Duolingo. You can tell where my brain's at these days with my
Yeah.
kids and our Alexa music playlist. So everyone has a few minutes a day to kind of teeter at this and plug away a little bit at a time. So we've built it very intentionally to try to minimize the overwhelm, while also appreciating that this by its very nature is an overwhelming undertaking.
Okay. All right. Well, thank you for that.
Yep. All right, what's on the next slide? Let's see. So all of the things we just walked through, our platform at Eleplan addresses. We have a knowledge base, which is basically like a custom ChatGPT model. So as you're building your Eleplan, this kind of goes to the overwhelm as well. Eugene, as you build your Eleplan, you're rewarded with a knowledge base that is fueled with your personalized data. So rather than us asking ChatGPT generic information about Liam, a 27-year-old man with autism living in New Jersey, we can ask specific questions about his specific routine and preferences and triggers based on the information that my parents have populated in his Eleplan. Similarly, we have a plan customizer that allows you to customize in over 1 million different ways. So depending on the person that needs to see the plan, whether it's a new doctor at a long-term care facility, or a new special education teacher, or a new job coach, even a babysitter pinch hitting for a couple of hours on a weekend, you can customize and share only the appropriate pieces of information from your Eleplan. We offer collaboration and contact management. Next slide, please. I mentioned security, so we're obsessed with security at Eleplan. So we have secure storage of documents and also sharing. So something as simple as We encourage our users, rather than to download a document off of their document storage hub on Eleplan, you can actually share via time expired links and QR codes. Again, trying to encourage our users to prioritize their security so that those documents aren't just sitting as PDFs in somebody's inbox in perpetuity. For our B2B partners, which are group homes, home care agencies, community support programs, nursing homes, et cetera, we offer expansive data collection. So every single data point that we collect granularly can, in theory, be used to indicate trends of diagnoses and care imperatives. And then that data collection, as I mentioned before, is fueling our knowledge base, which the user can then use for kind of quick one-off questions, and then secure account access via two-factor authentication and security layers, passkeys, et cetera. Next slide.
Could you address time stamp QR codes or the time limited?
Yeah. So you can kind of see in this bubble here on the left-hand side. So the Eleplan itself can be shared by time expired QR links or secure links. Both operate in the same way. Basically, you're sharing an expiring link or QR code so that the person, let me give an example. A police officer reports to our house for an incident. We want them to have a very quick glimpse of Liam's triggers. So, for example, if the police officer that came to our house had tattoos and was a smoker, Liam would be way more likely to act aggressively. And so in the crisis, my mom might not be able to explain that to him. But if they're on the town registry through a secure QR link, we can share with that police officer for 15 minutes, for 1 hour, information that he needs to know about Liam in that crisis situation that he would no longer have access to after the crisis is resolved. So the idea about the time expiring is, how long does the recipient need to have access to that information? We don't want them to have Liam's name, height, address, date of birth, and health insurance information in perpetuity. We want him to have it for as long as we say he has it. So it's just kind of an extra layer of security in that regard. Does that make sense?
Yeah, no, it's just something that people may not be familiar with, and so
Yep.
I wanted to highlight that.
Sure. And again, just to extra emphasize that, it goes into not only how we share the Eleplan itself, but also the documents and other assets that the users are bringing onto the platform. So offering our users that kind of freedom and flexibility to share what's important to them, both from the plan itself and the documents that they have in daily life. You've met Liam a little bit now that I've talked about him. I'm going to share a couple of stories about him to kind of paint the picture. So a few years ago, I was visiting my parents in New Jersey, and Liam had an incident that required the police to come to the house. He was ultimately taken to the hospital for a psych evaluation, and my parents went to the hospital with him. My mom was in the ambulance with him, and my dad followed by car. And my mom called me from the ambulance with questions like, can you send me the guardianship paperwork? It's in a pink folder on the third shelf above the phone. Now go to my desk drawer. In the second-hand drawer on the right-hand side, there's an orange folder that has his medication list. Can you take a picture and send that to me? We got a new prescription this week. It's in the pantry on the bottom floor, left side, blue bin, the one with today's date on it. Can you send me that? I was there to send her all of this information, but the obvious question is, what happens if I wasn't? Yes, my dad could have turned around and gone home and gotten this information. But when your son is having a psychiatric incident that requires him to go to the hospital and police are involved, the last thing you're thinking about are the documents that you need when you get to the hospital. You're just thinking about calming him down and making him feel okay. And for my dad, being with his wife when they get to the hospital to support her. So that has kind of always been in the back of our brain when building Eleplan, is like, how do we solve for those moments of crisis where you don't always have the luxury of being prepared and getting all of your ducks in a row and getting the documents that you need for that doctor's appointment. So that's kind of a more extreme example. Another semi-extreme but sort of long-term example, about 10 years ago, Liam jumped off a balcony in our house. He got into a fight with my dad over the the charge level of his laptop. So 10 years ago, Liam was obsessed with his laptop, could not go down below 12% battery. If it went below 12%, he thought that like literally the world was ending and it was a major issue. And we were trying to intervene in ways that would make him show like, it's okay. Look, it got to 11%. The world did not end. The computer did not explode. Everything's okay. And it sort of backfired on us. And he jumped off a balcony in our house and landed on his tailbone, had 7 compression fractures in his spine, and was in the ICU for several weeks. After that incident, my parents made the really hard decision, and I might get emotional, so forgive me, but we sent him to a residential facility in Pennsylvania for a year. And the determination from his care team in collaboration with our family was self-harm, whether done in a manipulative way to get back at my dad for letting his computer go to 11%, or intentionally actually wanting to harm himself. It didn't matter. It was a line that we weren't going to allow him to cross again, the consequence of which was him going to a residential facility. For someone like Liam, who crave isn't a strong enough word, he requires routine, he requires structure and stability. So for him to have to go and leave the only home he's ever known for a year was gut-wrenching for everyone and really difficult for him especially. He had to be literally physically removed from the house by aides from the service provider. When he was at this facility in Pennsylvania, he had multiple people that were working with him on a daily basis, from paraprofessionals to the supervisor of the whole program and residents. And my parents were in touch with these people all day, every day, trying to make them understand who Liam is and what triggers he has. So my family is pretty mortified by this, but Liam knows it gets a reaction. He is pretty known to engage in racially discriminatory language whenever he has a paraprofessional that is not white. And he knows if he does that, that the para will quit or he'll cause some kind of issue and he'll get negative attention, which is all he's craving, is attention of any kind. The team at his program wasn't prepped on that. So they just thought he was a racist asshole. And they basically just like put him in his room and wouldn't engage with him. So rather than taking the steps to understand that he's doing this to get attention, we know absolutely it's wrong. But you need to pair him with someone that can work on this with him, just like kind of almost like exposure to a smoker. Like, how do we actually teach him in tangible ways that people have differences and we can be around them? My parents didn't really have a good way of getting that information to his care facility. And so the idea is that with Eleplan, we can teach his care providers, present and future, all of the nuances. In his current program, the elopement thing is a really big deal. So the fact that he has this happy run, he'll run 100 yards away. So if you're a new therapist working with Liam, it looks like he's eloping. And a new therapist who's a 22-year-old grad student they've panicked thinking he's eloping. And they've had to, be trained over time through paper and pen and ink from a computer on paper, how to, recognize these nuances of Liam's behavior. So kind of just 2 more real life experiences from our family. And then on kind of like the happy side of things, I know those were kind of heavy examples, but we want Liam, we want people working with Liam to know him the way we do, as far as his love for SNL and Weird Al and Stephen King, so that when he wants to share something joyous with somebody that's taking care of him, they know what he loves and they can engage in those interests with him. Next slide, please, Eugene. On the other end of the spectrum, just to kind of paint a different picture separate from autism, this is a case study about Rebecca. She is 68 years old, loves travel, food, and family. She had throat cancer 10 years ago. And ever since her remission, she has had difficulty swallowing. So she can only take pills with a banana. If she takes pills with applesauce, she will aspirate. She went in for routine knee replacement surgery 4 months ago. When she was coming out of anesthesia, the nurse gave her applesauce with her pill with applesauce. She aspirated. I ended up having to go into a medically induced coma and is now on a feeding tube for the rest of her life. And so can enjoy food the way she used to, and otherwise completely healthy 68-year-old woman. This is an example from a close friend of mine. And when she told me this story, I immediately thought of Eleplan and what we're building and how we could integrate it into point of care providers who are boots on the ground, because I actually don't begrudge that nurse in the hospital. She's an impossible job to review an entirely comprehensive, massive medical chart. So how do we get the core information to her? At Eleplan, we have something called a quick view, which includes what we call care imperatives. So what are the top few things you need to know to keep this person alive, whether it's a deathly allergy to peanuts, can't take a pill without a banana, or maybe they are a non-speaking autistic adult who comprehends Spanish. What are the things that we need to know to properly care for them? So at Eleplan, that's another example of the information that we're trying to bring together.
So
Next.
could you make this available as would this function kind of like a medical bracelet?
Yes, we're exploring that option. Again, security is our number one concern at all times. So something like a QR code, for example, is great for ease of sharing, but there are still some security questions about it. So it's something that we're considering and talking to potential hospital partners about what is the solution that gives that kind of quick access component, but also reserves the control to the primary caregiver of the information and how and when it's sitting on that bracelet or whatever the instrument is.
Yeah, but I was thinking that you could use a phone as a replacement for a bracelet, where
Yes,
because you
yep.
could keep more information in there.
Yeah,
And
yeah, go ahead.
I was thinking, and there may be, I mean, with all the cyber work that's going on, there may very well be something that could easily be implemented into a microchip.
Yep. It's something that we're exploring, kind of the concept of like a digital emergency bracelet. Yes, the phone works for now, but it's something kind of like in our next iteration. It's one of the target goals for the platform of kind of how to get it. Again, our number one goal is basically providing caregivers with an easy and safe platform to share information with whomever needs to get it. However, by whatever means, right? And so there's endless opportunity for us to grow into other mechanisms to share that information.
Okay.
Yep. Next slide, please.
Yeah, I would think that's something that we could easily ideate on and come up with a solution.
Yeah, definitely. I'm glad that Zach's on this call because he's the tech brains to my business, so he probably has ideas flowing in his brain right now. And I would be remiss in not saying I know David talked a lot about kind of the challenge and bandwidth of hiring developers and finding that those the key people to build your team and grow your product. And I've been extremely lucky to have an equal partner in Zach from day one, and he's our developer and CTO. And everything that's been built on Eleplan has been built by Zach, and it does not go under appreciated by me how lucky I am to have a developer in-house that is my partner. And so I know the struggle of other founders is very real in that department, and we're extremely lucky to be where we are because of Zach's experience. So
yeah, Because I'd like to get you in. I mean, are you working with the VA at all, or?
Not yet, but they're on our target list because
Okay,
we're quickly expanding our B2B enterprise partnerships with,
okay.
VAs and
I can help
in
you there.
beautiful.
Um, I also think that this would be really good for, so Army Research Lab, they have these developmental commands, and one of them is the Soldier Center. The Soldier Center does a lot of work with PTSD, traumatic brain injuries,
Hmm.
triage, and those kind of things, and as well as John Hopkins. We're
Yep.
we're in touch with John Hopkins as well, so I can see some connections there that we could make where there could be some collaboration that
Yes.
where your work could help them and their work could help you. So I'd like to set those up after this as well.
Wonderful. I appreciate that, Eugene. Thank you.
Okay.
I've been trying to figure out a way to tap into the military branches. I have a brother-in-law who serves in the Air Force, and we've been kind of noodling on some of this. So would love to pick your brain on those connections. Thank you.
Yeah, 85% of our community is federal Department of Defense. The next largest percentage is academia.
Hmm. Awesome.
So,
Let's connect, please. Thank you.
yep.
And I'll kind of end on the I mentioned AI and where does this come in and why should you care? Um, we have, as I mentioned, been passionate about security at Eleplan from day one, and we were both lucky and challenged to launch a new business the year that AI exploded for the general population. I'm sure for many of you on this call, if you're in the DoD, you guys have known about this forever, but for lay people like me, it's been, a pretty new dawn in the last year. And so we had this amazing advantage and opportunity with Eleplan to integrate AI into our platform. The question was, how do we do it safely and responsibly? When we first launched the V1 of the platform, it was very much the user would answer questions to fill in their Eleplan, and the AI component was taking that data and translating it into a natural language paragraph that then fed the plan. We still have that component, but the next piece now is the knowledge base that I mentioned. And this is your custom ChatGPT model. The next slide will have an example of it, but I kind of want to tee it up. What I'm sure you all know, but to the extent you don't, when you use ChatGPT today as a lay person just going on to openai.com or any other LLM, it's storing your data for at least 30 days on its servers and using that data to train its models to serve, future users and their data and their questions. With the data that we're collecting for Eleplan, that was pretty much a non-negotiable for us because we needed to make sure that our users' information was protected. So Zach spent 8+ months working on an agreement with OpenAI that allows us to have zero data retention. So there is no conversational component. That the LLM that we have, the knowledge base that you'll see an example of in a minute, is completely taking information only from the data in the Eleplan. So it's kind of a twofer for us. One, it's incentivizing the user to actually complete their Eleplan because the magic is the knowledge base. And then we have the extra layer of security, knowing that we can offer peace of mind to our users when AI is questionable and we don't really know what ChatGPT is doing with our information. With Eleplan, you have the security of zero data retention in mind. And so if you want to go to the next slide, please, Eugene, you can kind of see this in action. And again, this is for a plan that has been pretty robustly built out. And you can kind of see the reward of that. This person's asking how to prepare for a guardianship meeting next week, and what information should they bring. Because they have information and they've uploaded documents relevant to this, the knowledge base can actually not only give them a list of information to take, but also link to the actual documents. So again, the reward for the legwork, yes, it's work. Yes, it's overwhelming to get everything in one place. But at the end of the day, you have this tool that every time you need to call in that information, you're not wasting hours and hours and hours of time finding the old email, downloading the PDF, scanning the PDF, however you're accessing this information. So, and I think that's the last slide, Eugene, but if you want to check for me. That's it.
Nope,
So
that's
happy
it.
to answer questions or anything else.
All right, well, I'm going to pick on people in the chat. So, so Sean McDermott, if you could unmute and share how you may be able to help.
Yeah, sure. I appreciate it. Great presentation. Like I said, that really cool story. So we're a company that really just helps small businesses, new tech startups, get into the DoD space, right? And then help scale within, usually through the sitter programs to get sole source authority. But there's a lot of different funding opportunities out there that we can go after and help with. And yeah, so if you want to connect, please let me know.
Awesome. I'm grabbing your email now, Sean, from the chat. Thank you.
Awesome.
Okay, Troy, you want to share some of your ideas?
Yeah, some others, you probably thought about this, but not just the VFW. You may want to leverage the advocacy groups for the veterans in the military. For example, the Military Officers Association, VFW, American Legion, Air Force Association, MilStar, those type of things, for a number of reasons. But they also have programs to help veterans as well as active duty. So they may be able to help you over.
Awesome. Thank you for that, Troy.
Would you mind putting your email in, Troy, in the chat? Thank you.
Sure.
One of the things that came to mind as you were talking through that, Troy, is, you know, and when you first mentioned VA, Eugene, is right now we're built primarily to support the caregiver that's building information for the individual, like the Liam of the world. But the first question we ask at onboarding is this plan for you or for someone else? And the scenario of a self-advocate, if Liam were a little bit more independent, or if he were a vet coming back and suffering from PTSD, or maybe we're dealing with somebody with early onset Alzheimer's or dementia, there's an opportunity that we see for these patients, for lack of a different word, to build a plan for their loved ones to care for them in their own way. So similar as like we plan for death, we plan of like, how do we want, you know, do we want to be cremated? Do we want a funeral? Do we want, you know, et cetera? Is there a way to build a plan that says when I'm having an episode from PTSD, or when my mind goes, you know, south, here's how I want to be cared for? So we're definitely exploring opportunities there too. And I think that would be really neat to do with these communities.
Okay. Troy, you got something more you wanted to say?
Yeah, with that, being a commander, retired commander out of the Air Force, some of the things in it's more of a question and a statement put together. But what happens for a military member that does have an autistic child, or a child that requires special treatment? Being in the military, where you're moving every 2 to 4 years, sometimes across the world to different countries, would your platform be able to be modified to help those individuals with special use cases, military families that have children that have restrictions because of the military? Over.
100%. And I think it's a great, my brother-in-law and sister-in-law just got back from 3 years in Okinawa with the Air Force. And I know just from their navigation with my nephew, who was the typically developing kid, but had some like asthma and other cardio issues, there were definitely components where having an Eleplan would have helped, and we can solve for almost all of them. And then I think with partnership with some of these agencies, we can understand the questions that we need to be asking for military families. There's absolutely a place for that in Eleplan.
How about the commanders? Because in my case, I didn't have the child, but I was responsible for that family and providing them mentorship and guardianship. So they come to me. I have a member come to me saying, "Hey, I have an autistic child. I have special requirements. How can what do we need to do to come up with a plan so I can carry on my career while at the same time taking care of my family and my needy child, so to speak?" Sorry.
Yeah, no, that's fine. I think the answer would be, you know, here's Eleplan as a resource, and help, you know, build it in partnerships, you know, with you or support. And then there are resources on base or within our community that can help. Also, the more we build out our network, we'll be able to identify, you know, even through like geographic information and data, that maybe there's another autistic family on base that isn't under your command, but we can refer them to because they're both on Eleplan. Again, that takes growing out, but I think the first step is we see you and we understand that you need the support. Here's a resource. And then, let's grow from there together and figure out how to support you further.
All right.
John, do you have a question? I see a hand raised.
Yeah, John Ellingson.
I've got two of them.
Okay.
I had lunch today with an old colleague, retired out of the IC, who's suffered a stroke. And brain is just fine, hard time walking, can't take thoughts and make words out of them. Has a real hard time. Do you have a program for people with stroke?
So our program might be a strong word, but Eleplan caters right now to over 100 diagnoses, and that list is growing every day. So we do ask questions about stroke victims and intake and the kind of support that they need. Again, that could be done in partnership with a caregiver if they are capable enough to make their own plan. Maybe he can articulate through Eleplan how he wants to be cared for. Short answer is yes.
Well, he can communicate well,
Yep.
writing. He just can't speak. How do I get a hold of it? I'd like to pass it on.
Yes. So that was my ask for you guys is our website is www.eleplan.com, ELEPLAN. You can see it on our website. I will share a code with Eugene after this that I can share with all of you for, there we go. Thank you, Zach. He just dropped the link in the chat. Thanks, Zach. And yeah, you can join for free. We have a freemium access, so you can kind of poke around and see it. You can share with others, and we're growing our community of partners and caregivers and individuals like Liam. So the number one ask is just kind of, you've kind of overwhelmed me with all the information already and ideas for connection points, but my number one ask was partners in the space where we can kind of grow into new and unique communities. And I think we have that here. If you are a caregiver, if you know a caregiver, if you know somebody in need of care or Eleplan, please share it. We are up and running and ready to go. We have users today, and we look forward to growing our user base. And I'm just checking my list of other asks. We are currently fundraising, so we have about half of our $1 million pre-seed raised. And if you happen to know any investors, institutional or individual, that have an appetite for pre-seed, brilliant founders and growing companies in AI, just please send them our way. Thank you very much.
Okay, the other one I have is a story out of ER, again, a stroke victim. Who's in there waiting to get administered a clot-busting drug. And the neurologist is reading the informed consent to this stroke victim who's sitting there in a very tight window to get the drug, because you've got a very tight window to bust the stroke, otherwise you can do permanent damage. And they can't give an informed consent. They're suffering a stroke.
Right.
And most ERs, particularly here in Virginia, have implied consent in that setting, but here you've got somebody trying to give them an informed consent, taking 20, 30 minutes to go through the process and wasting time. It seems to me that's a perfect setting for a situation like you're saying, okay, don't do this, let's do that. And let's not waste this time and place this patient at risk. And I'm just wondering, what are you doing with ERs in this sort of setting? It seems absolutely made for the trauma hospital.
Yes, we've had a couple of meetings with some nonprofits that are partnering with ERs in New Jersey to try with autism specifically, but trying to get this kind of key information to ER staff. I think in the scenario that you just walked through, the key is the patient having decided and acted ahead of time to have that consent on file. With Eleplan, it would be, and then we can share it very easily with the medical staff in the ER. Frankly,
in this case, the law says you have implied consent in the ER. You don't need an informed consent.
Yeah. there's a lot of applicability in the ER. Getting buy-in from medical providers is, as I'm sure you all know, very challenging, but it's
the
a
lawyer
course
in the
where,
hospital, not the medical provider.
yeah, and as a recovering lawyer, I'm sorry for that. There's a reason I left the
Yeah,
law.
me too.
But yes, definitely applicability, and where it's a course we're chartering, kind of, when we have the right connections and kind of knocking on the right doors.
Thank you.
And so,
Great stuff. I really appreciate what you're doing. I think it's just absolutely magnificent and much needed.
Thank you so much, John.
thanks, John. Appreciate that. Thanks for being here. So before Jeremy had to leave, but he put something in about a smartwatch app. Jeremy Tootin, so you might want to make note of that if that's not something you've thought about before. One of my questions is, what about, so when I think of caregivers, I often think of medical professionals.
Mhm.
Can Eleplan help medical professionals that have multiple patients? So you're looking, you've been addressing a single patient with multiple caregivers.
Mhm.
What about a single caregiver with multiple patients?
Yes, great question, Eugene. Yes, we are built for that. So the kind of user interface on Eleplan now is when you log on in My Family, we show one plan for Liam. When my grandma was alive, we were taking care of her. We would have had a plan for Liam and a plan for grandma. On the professional care provider side, granted, they're given access by the family caregiver that has owned the plan or have bought licenses on their own to own the Ella plans. They would have a dashboard that shows all of their patients on one page, and then the access to information would be catered on a per plan basis, permissioned by the providers, both on the family side and the professional caregiving side. So, and yes, to answer Penny's question, kind of on a similar frame of mind, this would allow home caregivers. I was thinking of home agencies. Sorry, Penny. Maybe I'll address that question next. But I'll just say, yes, we are built for professional caregivers to manage many plans, or family caregivers to manage one or multiple based on the needs of their particular family.
So then if we go back to the medical bracelet thing, if there were a unsecure way to access a list of authorized personnel that the emergency worker or the police officer or whoever, because let's say that Liam did elope,
Mm-hmm.
and a police officer were to pick him up, that would there be a quick way for a police officer, either through a proximity device, where you don't actually have to have physical access to Liam, but be within 10 feet of Liam to access because they'd be able to recognize the challenge. And so if they could access a list of contacts that they could then start to call,
Yes.
without actually having to engage Liam.
Yes. So the quick view that I mentioned before would kind of be the baseline information to have attached to a QR or an emergency bracelet that Liam would wear. And that at a minimum has his name, his diagnosis, and emergency contact information. So my mom is on there as the first person to call. And then, depending on where he is, we can call the university program that he's a part of, or other caregivers. And we're also in conversations with Autism New Jersey about their law enforcement initiative, in which kind of is a state down training of police officers down to local municipalities, where the goal is to have, and again, this is autism specific, but insert X, Y, or Z, how do we make sure that our local police officers are informed about Liam and other peers like Liam, and then know to look for that emergency bracelet that helps them do their job more safely and securely.
All right, thanks. Yeah.
Yeah.
So Penny, was your question answered? If you can unmute. I don't know if Penny's still.
Yes. Penny, I'm going to put my email in here too. It's on the last slide, but the deck went away.
Oh yeah, sorry, I turned it off.
No, you're fine. You're fine, Eugene. Penny, email me because we can talk about it. The short answer is yes. The longer answer is it depends on the data. So we are built flexibly and we can kind of expand the data, query that we are collecting data on, the information. We're not built right now as like a data collection behavioral tracking tool. There are other platforms that do that, but kind of specific granular information about like what he did today. We're working on kind of integrating that into the platform as well. But I would email me one-on-one and we can chat kind of more about what you're referring to. And like I mentioned earlier, care agencies is a major partner of ours. Again, because there's some turnover and there's multiple different individuals they're working with. And so Eleplan kind of helps to streamline that access of information.
And Amanda, if you wouldn't mind, if you could keep me copied on non-confidential correspondence, because
Absolutely.
I like to understand these applications, because this is what we do is we find these connections, and that like we're trying to do right now.
Yes, I really appreciate that, Eugene.
And
Thank you.
the more I know, the better
Yep.
I can do that.
Understood. Thank you.
Okay, so I think we've covered everything in the chat. I don't see any hands up, so I'll ask if anybody has anything. I'm not hearing anything if people are unmuting. All right, so I will give you and Zach the last opportunity. I don't know if Zach has anything he wants to say, but go ahead if you want to close out.
No, I think Amanda got everything covered really well. But any technical questions you guys might have, I'm happy to answer them.
And thank you guys very much for the opportunity to present today and for the feedback and questions. We really appreciate it. And thanks, Eugene, for bringing us all together.
All right, thank you for being here. I really appreciate it. I think this went well, and a lot of good correspondence. I'll be busy tomorrow, that's for sure. And there are some people that I want to introduce you to from some past presentations. So I think
Awesome.
you knew Herb. Did you know Herb?
Yes, yeah,
Okay,
I know
so you know her,
yeah.
but yeah, you might want to check out Johnny Crowder and Coke Notes.
Yes, I remember that. He and I connected really quickly on LinkedIn, and then we haven't touched base since. So I'll make sure I reconnect with Johnny.
Okay,
As well.
Sounds great.
Thank you all very much again.
All right.
Thank you, guys.
Thank you.
Have a great day.